Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 99, clarifying a few points. Well, it happened again. I was on social media and someone made a common false statement about Medicare for All. They said that Medicare for All would cause hospitals to close. What do they think is happening under our current healthcare system? I quote from the New York Times, quote, "Over 180 rural hospitals have closed in the United States since 2005, end quote. Hospitals are closing under the current U.S. healthcare system and will continue closing under our current system. The reason these hospitals are closing is they can't remain profitable. However, we do not and will not have a functioning healthcare system as long as we require healthcare to be profitable under a capitalistic system." Singapore provides an excellent example of using the free market in healthcare. Singapore initially let hospitals compete thinking that free market competition would lower costs. Instead, the hospitals began focusing on wealthier patients by offering expensive services, buying new technology, and paying more to attract doctors. Lower-class patients were being ignored and costs increased. The free market failed, and the government in Singapore stepped in to make sure that the lower-class patients could get the services they needed. The previous example illustrates a major problem with the free market healthcare system. It chases the money. This is why hospitals in Singapore went after the wealthier patients, and why the hospitals in the U.S. are closing. There is not enough money in the poorer rural hospitals. Medicare for All would provide the resources for those hospitals to stay open. Now, when it comes to health insurance, there are many ways to chase after the money. As has been discussed several times on Medicare for All Explained, insurance companies regularly deny care and game the system to get more money out of payers. Medicare Advantage plans are known to get more money from the government by upcoding, including medical conditions in patients' charts, even if they are not being treated for them. Upcoding is so pervasive that Medicare Advantage costs more per patient than traditional Medicare. The above-mentioned problems and other problems in our healthcare system illustrate why the free market won't fix the U.S. healthcare system. And, as has been discussed several times on this podcast, why the U.S. has the most expensive healthcare system in the world with the worst overall health outcomes of any wealthy nation. Economics has a term when free markets fail, market failure. So even economists recognize that markets fail and that sometimes free markets do not and cannot provide a viable solution to a problem. So if somebody says the free market provides the solution to the problems with the U.S. healthcare system, cite the Singapore example. Then ask them to list one country where a free market healthcare system has worked. They won't be able to. There is a reason why all other wealthy nations other than the U.S. have national health programs. It's because the free market does not work in healthcare. So, if you want a working healthcare system in the United States, if you want to be able to choose any doctor or hospital, if you want to be able to go to the doctor or hospital without having to worry about costs, if you want to end medical debt, if you want to save $438 billion in healthcare costs every year, and If you want to end the 76,000 unnecessary deaths every year due to our current healthcare system, then you want Medicare for all. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.